Hello everyone, my name is Brian, and today I'm going to go over the closed chest drainage system, and we're going to demonstrate that with the use of the Pleurovac. First things first, just to kind of go over what this is used for. It's used for patients who do have air trapped in the pleural space, which is common in patients that have undergone chest trauma, and ultimately it does lead to complications such as um, tension pneumothorax. So, that said, I'm going to get started with the procedure. Before entering into the room, we want to check if it's the right patient. We want to make sure that they really do need the procedure. So, what we're going to do is that we're going to go over the patient's chart, see if it's the right patient, of course, and once we have all that set, now we want to gather our supplies. So in this case, we're going to need some clean gloves. We're going to need 1-inch adhesive tape. Of course, we need the closed drainage system. We do need a bottle of sterile fluid, and we do need a linen saver pad, and we definitely need a 50 milliliter catheter tip syringe. So when it comes to replacing a chest tube insertion site dressing, we definitely need some antiseptic solution, definitely a set of sterile gloves, and we definitely need petroleum gauze, a sterile 4x4-inch gauze pads, and a set of clean gloves, a sterile 4x4-inch drain pads, and also a mask with an eye shield. So that way the stuff doesn't get into your eyes. Okay, so upon entering the room, we want to make sure that we provide the patient privacy and then let our presence be known. Hi, my name is Brian. I'll be your nurse for today. Today we're going to perform a chest tube drainage. Is that okay with you? And then I would also verify if it's the right patient by verifying their name and date of birth and letting them know the procedure, and also performing the hand hygiene. And also I would put the personal protective equipment. So in this case, we're going to need to be sterile. Also, we may need a gown for this one, and have a mask to protect from any excretions coming at you. And we also want to dispose of the waste that's available. So now that we're about to replace the closed chest drainage system, first we want to confirm the absence of an air leak in the water seal chamber. And for the air leak, we definitely do not want to clamp the chest tube. And now we're going to raise the height of the bed. And now we're going to don clean gloves. And then we want to move the outer wrap of the drainage system, open the inner wrap, two sides, then back, then front, basically your usual sterile procedure. And we want to place the sterile fluid bottle and the mask within reach, set up your sterile field. And then now we want to open the bottle. Then we're going to remove the plastic connector from the device and attach it to the fill chamber. And we're going to instill the water seal chamber. We're going to instill the water into the water seal chamber and instill until it reaches 2 centimeters in height. And then now we're going to remove the cap from the suction control chamber and instill sterile fluid to the 20 centimeter mark, which is all the way up there. And if the unit does have an air leak, we definitely want to add sterile fluid to the indicated level. And we want to definitely place the linen saver pad beneath the patient. And then next, we want to remove the tape reinforcing the connection between the chest tube and the drainage tubing. So, and afterwards, we want to go and remove our gloves, perform the usual hand hygiene, and then we want to don more personal protective equipment. So then now we're going to double clamp the tube close to the insertion site by placing clamps in opposite directions. And then we want to disconnect the end of the chest tube from the old system and reconnect it to the new system. So now we're going to remove the clamps. So now we're going to remove the clamps from the chest tube, and now we're going to use the tape to secure the tubing from the old system and reconnect it to the new system. So before doing that, we want to discard the old system and all the waste, and put it in a biohazard or whatever garbage we got to put it in. And now we want to position the new system on the bed frame, which is why we have these hooks here. We want to make sure it's in place. And now we want to check for fluctuation in the water seal chamber, which may show up around here. And we want to see it as the patient breathes, see if there's anything going on. And we want to observe for any oscillation of fluid in the suction control chamber. And we want to adjust it as necessary, so there's some gentle bubbling. And we got to remember that some bubbling, it's okay, as long as it's intermittent. But if it's continuous, then it's bad. So now we're going to change the chest tube dressing. And for that, we want to assess their pain level, see if they're tolerating the procedure okay. And now we're going to raise the bed a little higher, and also we want to lower the head of the bed. And now we also have to don the PPE, which is your glove and mask. And we also want to position the patient on the unaffected side. And then now we want to place the linen saver pad underneath the patient. And we want to remove the dressing, and we want to note the color, consistency, the amount of dressing, the amount of drainage on the dressing, aka coca. And then you want to discard the dressing in a biohazard. And now you want to remove your gloves, and then as usual perform your hand hygiene. And now we're going to don sterile gloves. So this is where we're going to clean around the insertion site, but also you want to use the antiseptic as well. And now you want to place the sterile petroleum jelly around the chest tube at the insertion site. So now you want to place the pad across the chest tube and use gauze pads around the chest to give it more surface area. So now you want to place the tape so that it adheres firmly against the chest wall in accordance with the chest tube. And you want to tape it firmly against the chest wall so it doesn't come off easily. And you want to put it on the opposite side of the chest tube. And then just repeat the dressing and have it covered and sealed. And then as you go through, just assess the patient, continue to provide comfort, and discard what has been used. So now that we have finished the procedure, what's next is that we have to document. And then so what I would document is to know that the patient did sign the informed consent. We want to note the date, time of the insertion, and we want to note the location where it was inserted. We want to note the size of the tubing and the reason for the insertion, and we want to note for any breath sounds, any respiratory rate, and the O2 saturation after the insertion. And we want to know the amount and the characteristics of what was in the chest tube drainage. And we want to know the status of the dressing. And we want to note any complications if the patient had any reactions. And we want to make sure that the patient is also going home with a mobile drainage device. And we want to confirm that they do know the instructions, and we want to have their contact information as well, and make sure that they are scheduled for follow-up appointments. All right, so now we're going to actually document the chest tube drainage system itself. We want to schedule for drainage checks, any dressing changes, and we want to know the status of the insertion site, especially around the skin. Of course, we want to make sure it stays pink and moist. We also want to know the type of dressing that was used. We want to know how the drainage looked on the dressing, and when we want to also document the dressing change and time. And we also want to perform a respiratory assessment to make sure they're breathing properly and to make sure that, of course, that this is working. And we want to know the characteristics and the amount of the chest tube output, which comes out from here. And we want to know the function of the closed chest tube drainage system. And we want to know if there has been any changes in the procedures. So did they reduce the suction, or did they open the water seal? And we want to implement any strategies to promote ventilation, oxygenation. Of course, we want to go from least invasive to most invasive. So, as usual, we would always want to raise the head of the bed to semi-Fowlers to high Fowlers. We want to maybe encourage some incentive spirometry and any posture changes, and we want to also encourage them to ambulate. And that being said, we also want to assess their pain level, and we want to know if they're taking anything for the pain or if they're anything to help the pain get better. Okay, now let's say the chest tube has been removed. So now we want to note the date, the time of the removal. We want to know any breath sounds or any respiratory rate and depth. And we want to note the O2 saturation before and after the removal. And we want to know the characteristics and how the drainage looked after the removal. And we want to note the dressing application and how it looks. And we want to note if there was any complications that happened after the chest tube removal. That being said, this is my chest tube presentation. Thank you. Have a nice day.